Hello friends, I welcome you all in my channel Next in Orthopedics. Today we are going to discuss another topic in our journal club. I am Dr. Deepak Garg and our topic of discussion today is commonly missed injuries in the patient with polytrauma and the orthopedist role in the tertiary survey. So this was a paper published in JBJS in 2019 by Dr. Nicole M. Stevens and Dr. Nirmal Tezwani. So whenever a patient come in a casualty with a polytrauma, so in briefly I will tell you what are the primary or the secondary survey. So whenever patient arrives, we first do primary survey. In the primary survey, we do the follow A, B, C, D, E, airway, breathing, circulation, deformity and exposure. If you want to go in detail, then watch my video on polytrauma for detail. Then we go for secondary survey. In the secondary survey, once we assure that all the vitals are stable, airway, breathing, circulation, deformity, exposure, once these things are normal, then we go for head to toe examination of the patient, quickly looking, listening and palpating for the abnormalities, and this is a secondary survey. Now author in this paper has introduced a tertiary survey. So what is a tertiary survey and what is the significance of tertiary survey, that we will see in this paper. The tertiary survey was first introduced by Anderson et al. In 1990. It typically includes a complete physical examination of the patient after the patient gains consciousness if he is unconscious, or usually tertiary survey can be done during the next day morning rounds or after 24 hours of the trauma. The re-examination of all prior imaging studies, blood work and further radiographs should be done in the tertiary survey. So the author is dividing the tertiary survey into type 1 and the type 2. So the type 1 tertiary survey is the survey done after the patient gains consciousness. So we do a head to toe examination and find if we have missed some injuries. So that is a type 1. Type 2 is the survey done after the type 1. So if we miss some injuries while the patient is in the hospital or the patient is discharged from the hospital, after we have already performed a tertiary survey, then this is a type 2. In this paper, the author is considering the type 2 injuries as minimum as possible or equal to 0, so that the authenticity and the reliability of the tertiary survey is higher. So what are the risk factors for missed injuries in case of polytrauma patients? So if the patient is having high injury severity score, a high injury severity score is a risk factor, or a low Glasgow Coma Scale, then we tend to miss more injuries if the patient is unconsciousness or if having some more severe injuries, higher injury severity score. And it is seen that there is no difference in the rate of missed injury if the examination is done by either a first year PG, second year PG, third year PG, SR or a consultant. The rate is almost same. Whoever is doing the examination, the primary and the secondary survey, the rate of missed injury is almost the same. So these are the various papers which have been published showing the rate and the percentage of the missed injuries and the surgeries that missed injuries require surgery, the percentage of these missed injuries that require surgery. So the paper shows the missed injuries are almost 50% in all the studies. It's more than 50%, it is up to 80% also. It's more than 50%. And the surgeries and the injuries which require surgery is almost more than 50% in almost all the studies. So it proves that while in the primary and the secondary survey we miss significant amount of the injuries. This is mainly because when the patient arrives in the casualty, he is a moribund patient, he may be unconscious and he may have some severe injury at one part of the body. So we concentrate more on more severe injuries and more on stabilizing the patient, stabilizing the vitals of the patient. So we tend to miss minor injuries. So what are the injuries that are missed? So these are the areas of missed injuries. So we tend to miss the clavicle fracture, the fracture in the hand region, fractures in the foot region, and the scapular fractures. These are the injuries that are missed commonly. These are the various papers published showing which fractures or which injuries are missed most commonly. So the hand injury, foot injury, scapula, clavicle, these are the most commonly missed injuries. All these papers prove this statement that these injuries are the most commonly missed injuries. So what should we do to avoid these injuries and to manage the patient properly before we discharge the patient? So after we do the primary survey and the secondary survey, we admit the patient either in the ward or in the ICU with or without oxygen. So we wait for the patient to become vitals stable, patient conscious and cooperative. So once the patient gains the consciousness, then we should do a tertiary survey. Tertiary survey can be done by a first year resident, by second year resident, or anybody on the rounds, in the morning rounds or in the evening rounds, if the patient has already gained the consciousness. So in the tertiary survey, we again do head to toe examination. We first will assess the cervical spine movements. We will assess the shoulder joint, arm, elbow motion, forearm, and we palpate and see the range of motion in the hand. At the MCP, IP joint, wrist joint, we will assess the range of motion if there is any tenderness. Is there any swelling or bruise? We will assess that. Similarly, we will see in the lower limb, we will see the hip, knee, ankle and the foot region. We look for the tenderness, any swelling, range of motion. After the upper and the lower limb, we should examine the pelvis if there is any evidence of the pelvic trauma. Spine examination should be done thoroughly, and then we should palpate for the distal pulses. And whatever injury we detect should be documented and treated properly. Thank you all. Thank you guys.